The big, beautiful bill, as Donald Trump likes to call it, his signature bill, has made it through the Senate with a vote of 51 to 50, tiebreaker going to JD Vance. Is it really that beautiful? How much money is being cut out of Medicare and Medicaid? I'm Dr. Hasan, board certified trauma anesthesiologist. Let's get into it. It's called the big, beautiful bill, but is it really that beautiful? There are massive, massive Medicare cuts, rural fund that smells like a bribe more than a fix. Do you even know about the rural fund? It was basically created to pacify red state senators. I'll tell you more about it in a second. Let's break it down, what it does, who it hurts, and who it quietly favors the red states. What is in the big, beautiful bill? Well, the 2025 version has tax cuts, border security, which we've heard about over and over again. They want to amp up border security, and major healthcare rollbacks. Healthcare does comprise up to $2 trillion of the budget every single year. It was passed by one singular vote in the Senate. The VP broke the tie. Razor-thin margins in the House as well. It cuts Medicaid by an estimated $793 billion over 10 years. Now, I want to tell you before we get any further, the difference between Medicare and Medicaid. Medicaid is essentially if you do not have enough money to afford health insurance. Medicare is a type of insurance you get from the government when you reach 65 years old. Medicaid is funded both by the states and the federal government. Medicare is funded specifically and entirely by the federal government. The bigger problem with the big, beautiful bill is that it adds between 2.4 to 2.8 up to $5 trillion in debt over the next 10 years. Actually, an insane number. It's actually the biggest increase in the debt ceiling that we've seen. 10 million Americans are projected to lose their healthcare coverage. This is specifically because in the Medicaid section, there is a work requirement now. If you are an able-bodied human being, you're going to have to work. This work requirement for Medicaid goes between the ages of 19 and 64. The CBO, the Congressional Budget Office, is estimating that about 11 million people who are on Medicaid now are not going to qualify for Medicaid in the next 1 to 2 years. There are no direct cuts to Medicare specifically, but if you look between the fine lines, because you're decreasing taxes, you're going to decrease the funding of Medicare because Medicare, the trust that actually funds Medicare, only invest in government bonds. They don't actually invest in the stock market. So the gains are pretty much projected out for the next 5, 10, 15 years because if you buy a government bond, you actually know how much money you're going to get back in 5 years, as opposed to the stock market where it can increase exponentially. Now, Medicare has no direct cuts to it, but if you decrease the amount of taxes you're collecting every single year, insolvency comes closer and closer. Right now, they're projecting insolvency somewhere in the 2030s, but with this bill passing, they're actually projecting it to go from anywhere from 2029 to 2031. So within the next 7 years, Medicare could be insolvent. That seems like a massive oversight in my eyes, unless they come up with another plan to kind of fund Medicare. One of the ideas that I've heard in the past is that they actually take some of the Medicare trust funding, put it in the stock market. Had they done that when they created Medicare in the past, they actually would have been able to fund it for another 40 to 50 years based on just investing it in the SPY, which is the index fund that tracks the S&P 500. Now, there's going to be higher indirect costs, higher premiums, and more out-of-pocket for seniors. Who's hit the hardest? It's actually rural hospitals, the same ones that are already closing at record rates thanks to the ACA or Obamacare, which offered a lot of consolidation options to all the bigger hospitals, therefore pushing out all the rural hospitals that were non-profitable. Many of the rural hospitals in rural America, try saying that 3 times fast, many of those hospitals reside in red states across the country. Now, because Medicaid is being cut, there's going to be less payback or less insurance money that comes from the federal and state governments to these rural hospitals because there's less private insurance in, let's say, parts of Kentucky, parts of Iowa, parts of Idaho, parts of Montana. There's not a lot of private employers out there, so all the funding that these rural hospitals and critical access hospitals, all the money that they get comes from Medicare and Medicaid specifically. Now, in order to get 50 senators to vote yes on the bill, they had to create what they call as a rural fund, rural healthcare fund. This is estimated to be about $3 billion a year starting in 2027. The essential goal is to give this $3 billion to rural healthcare hospitals to keep them afloat. They're going to be cutting about $119 billion every year. They're going to give back $3 billion specifically to rural hospitals. That means that the major hospitals in the major cities are not going to get that funding. It's actually a problem because a lot of small towns across the country, I've lived in some small towns across the country, essentially the hospitals are the center of that city or town, especially in areas where industry has kind of gone away. Think about the Rust Belt. A lot of the hospital systems in the Rust Belt cities are some of the biggest employers out there. If they get decreased funding, even from Medicaid, it's going to have effects in the real world, meaning people people are going to lose their jobs. A lot of medical people are going to lose their jobs. A lot of accounting people are going to lose their jobs. A lot of logistics and supply people are going to lose their jobs. So this is going to be a problem we're going to see manifest itself in the next 5, 7, 10 years as this bill goes on. Now, the rural healthcare fund itself is split across all the states, but predominantly it's going to be going to red states. So a lot of analysts and politicians or political commentators out there are calling it a bribe, essentially, to get the senators from the rural red states to come on and sign and say yes, essentially, to this bill. It happens on both sides. Don't think it's a Republican thing only. They actually do it with the Democrats as well. There's very specific funding that helps big blue cities or rural red cities. There's a lot of this every 4 years, but the idea that you're going from 119 to 3 is a pretty big deal. The red states are usually more rural. That means more Medicaid dependent and more hospital closures. Now, what can you expect in the red states? Well, the $3 billion a year is essentially intended to help keep some of these rural hospitals afloat. But the fact, like I talked about earlier, a lot of their funding does come from Medicaid. So what you can expect in the next 2, 3, 4 years is a lot of small hospitals across the country probably closing or selling themselves to bigger giant monopolies out there. If you live in a small town and your ER shuts down or your hospital or your family practitioner office shuts down, it's because of this bill or indirect results of this bill. Politicians do love the headline, big, beautiful bill passed, but when you read between the lines and you read between the fine print, you see that it gets pretty ugly. What is the take-home message here? Well, the idea is that there's a lot of money being spent inside or outside the government, and we can't continuously spend this much money. However, we are actually raising the total debt by $3 trillion. That means we're actually making the debt worse. When Donald Trump and a lot of the Republicans who came into office, they promised decreasing the budget, but they're actually going to be increasing the budget by $3 trillion. On top of that, it's going to affect some of the most compromised populations in our country. It's going to affect children. It's going to affect the elderly. It's going to prevent a lot of people and patients from going in to get care. In the end, they're going to end up in the emergency room for emergencies that probably could have been prevented, whether it's asthma attacks, bowel disease, or hypertension. They're going to end up back in the hospital anyways. Now, there is a law in the United States that anybody who shows up to the hospital has to be treated. It doesn't matter if they're undocumented, documented, if they're a citizen or not citizen, if they have health insurance, they don't have health insurance, they have to be seen in the hospital. So if you get rid of a lot of the Medicare and Medicaid programs and products out there, you're probably going to see a lot bigger uptake in your ERs. You're going to see a lot longer wait times, and it's going to change and shift the dynamic of healthcare and medicine in general. Now, I know a lot of you want to know what my opinion is. My opinion is that the country itself is spending way too much money. We do have to decrease the deficit. We do have to stop borrowing money from the future and using it now. But in reality, we spend a lot more money on war games and wars across the world. If we could just shift all that money to our healthcare, I would be a much bigger fan of that outcome than cutting back healthcare in the United States. Doesn't make any sense. We do have the most robust, best healthcare system in the entire world. If you want to have a knee replacement in London, it could take 6 months or a year. If you want to go to Canada and have a bowel resection done, it might take 3 months. If you want to have a knee replacement done tomorrow, you could probably have it done tomorrow in the United States, anywhere in the United States. So it's a very different system here. We are used to getting what we want really fast. In other parts of the world, especially like the UK, sometimes if you're over 70 or 75 years old, they don't even treat you. They just let you pass on. Even if you're in good health, they have different standards. They don't do emergent procedures like interventional radiology procedures after 5 o'clock. They don't do a lot of emergency procedures after 5 o'clock because there's no incentive for it. So that's kind of the capitalistic structure that helps, and we benefit from it in the United States. However, it is a giant cost. But that being said, we could probably engineer or social engineer some of the funds that are going over here to blow up different countries and bring it back home to help our healthcare institutions and hopefully help our roads, bridges, and transportation here in the United States. That's my opinion. I don't have a horse in the race, as they say. I'm not a fan of people losing their healthcare coverage in general. I think it's a travesty in today's day and age that people have to fight for healthcare. There's a fight to get I think it's a travesty in today's day and age that people have to fight for healthcare, that people have to go out and beg for money, that people go bankrupt if they have any sort of major healthcare complication. Let's say you're a family of 4 and one of your parents has a stroke. That could be a bill of over $200,000 if you're not insured. And so because of that, it creates this dynamic of anxiety for everybody out there that if they have some sort of medical complication, that they could be financially ruined, their kids could be financially ruined. That has to change. But the big, beautiful bill is going to add even more pressure to that system that's kind of breaking. A lot of patients, a lot of people, even a lot of doctors out there are scared. They don't know what the future of medicine, reimbursements, salaries, all those things, as well as healthcare in general, how it's going to be affected by this big, beautiful bill. I'm not entirely a fan of increasing the debt while decreasing your healthcare coverage. That doesn't make any sense to me. If you were going to decrease the debt and in return there's decreases in healthcare coverage, that would make sense in my brain. But if you're going to increase the debt and then decrease the healthcare coverage, that makes absolutely no sense to me. And the senators and Republicans out there that went ahead and said they're going to, they ran on the idea of decreasing the federal budget. I think Elon Musk actually made a tweet about this the other day. They're going to have a lot of questions to answer at their town halls, and next time they run, anytime they come out into public, a lot of seniors, a lot of young people, a lot of those that are affected by this bill are going to be questioning what their thought process and logic was for putting them in a position to have more stress and anxiety. Now, with that being said, the idea of having able-bodied workers, able-bodied people have to work or do some sort of community service or have some sort of role in society, I'm a fan of that. I don't know how you implement that and who makes the judgment calls as to what type of back pain is severely debilitating while what type of back pain is not severely debilitating. There's no objective test out there that kind of decide whether or not you can or can't work. It's really just a judgment call, usually made by a physician or a nurse practitioner who works at these federal agencies and essentially reviews charts. There isn't really a formal interview process or anything like that. So I'm not really sure how you implement these rules and regulations that they came up for Medicaid. But with that being said, I'm also not a big fan of having sweeping litigation that could affect 10, 15 million people across the country. There's a lot of things in the big, beautiful bill that are very interesting. The healthcare aspect of it is very concerning on my end. What do you guys think? Thank you for making it to the end of the video. If you can, please like and share, leave a comment below. I love you guys. You know that. I'll see you on the next one.